Okay. All right. We are
Hey,
live.
we are live.
We are live. We are live. Hello, everyone. Dr. Olabintan here. I'm so excited and so pumped. I know I say that often to be doing this live today on this beautiful Tuesday evening. If you are watching live, hashtag live. If you're watching replay, hashtag replay. I have a favor, please. Could you drop where you are watching from? Put live and what state you're watching from, and also who invited you to this live. We're going to be talking about how to speak up for yourself during your pregnancy. I say this often, okay,
Mhm.
that I'm excited. I'm so delighted to be here. But this one is very near and dear to my heart um, because of what it represents and the advocacy that you do. So this is going to be good. So um, let's go right to it. So I
Yeah,
have on as my guest Miss Tobi. Okay, don't forgive me. Tajomavwo.
you did great.
I
It's
did?
Tajomavwo. So that V is silent. It trips everybody up.
Okay,
Yeah,
Tajomavwo.
yeah,
Okay.
yeah.
She's an amazing human being. She is a nurse. She's also a dedicated maternity wellness advocate and the founder and CEO of Ajoke Nursing Concierge. I've had the privilege to know her for a few years, and she's here to talk to us about said topic. Toby, thank you so much for coming.
Absolutely.
Please introduce yourself, who you are, what you do, and why you do the things that you do.
Absolutely. Well, first of all, it's an honor to be on your podcast or your live because I know this can be streamed anywhere on YouTube. So I'm also honored to be here and really appreciative for the work that you do. There isn't many providers out there that is overly passionate to making sure that their patients have really good experience, and I hear so much about that from you. So it's an honor to be here. So yes, my name is Tobi Tajomavwo. I am the CEO and founder of Ajoke Nursing Concierge. So I've been in healthcare for over about 17 years. And in that time frame, I've been a registered nurse. I've worked at the bedside from mother baby, NICU, pediatrics, and then spent a really good time in corporate healthcare, working as quality and process improvement for a lot of um, hospital organization. So I've gotten to get in all sides of healthcare, which has been amazing. But really, what drew me to this work that I do, particularly right now, is because I was once a mother who went through fertility challenges, who also went through having losses and having births. And I realized there was a lot of, let's say, the process could be streamlined a little bit better. And I'm such a quality process minded person. I just saw so many gaps. And I think the repetitiveness of hearing about all the statistics really can be very daunting. And I wanted to be a solution. And I actually started this right after I had a very traumatic miscarriage where advocacy was the only thing that saved my life. And I had to be my own advocate. So from there, I had the strong desire to be able to be that voice of advocate for women and their partners going through fertility and the birthing world. But not only that, make sure that they're fully aware of how they can advocate for themselves too, and not have a fear of birthing, but actually let birthing be a beautiful experience and not carry that load of I just want to come home alive or I don't want to be a statistic. So that's how I really got into this work, and it has truly been an honor to serve many families throughout the DFW. I have clients that started with me from their IVF all the way to postpartum, and I have postpartum moms that still meet up with me in our monthly mommy mingle. So it has been a true honor to start this journey. So thank you for asking that amazing question.
I'll be honest with you. I'm so happy that you turned your pain to purpose. Big
Yes.
deal, because you could have shut down, go into PTSD. And I'm not downplaying those who have gone through that, because PTSD is real. I think a lot of people go through it. We just don't call it that. But you use that, you channeled it to help you empower other women to not have to deal with the same thing. Now, the purpose of this conversation is not to make people scared or say, oh my
Absolutely.
gosh, it's
Yeah.
no, it's saying these are things that you need to do to advocate, to speak up for yourself. Let's talk about why is it important for them to advocate for themselves, particularly during pregnancy. You mentioned The statistic.
The statistics,
Wow.
yes.
You know what I'm saying? Yes, yes.
Well, many people aren't aware, and I hope they should be aware, that this week, starting from the 11th all the way to the 17th, is actually Black Maternal Health Awareness Month week. So this week is really spent on the advocacy, hearing stories of birthing women, but also making sure that we're turning this into action. So again, the statistic part is, unfortunately, in our country, we as African-American women, women of color, we die 3 to 5 times more than any other race, which is really, really unfortunate, especially in such a first world, very developed country. We deal with those statistics, and a lot of that is rooted in systemic racism, is rooted in disparities in local communities, not being able to have access to care. So the importance of advocating for yourself during pregnancy is because I feel like that's when you really start, that's when your journey into parenthood starts. When you're advocating and speaking up for yourself, you're also advocating, speaking for your child. And if you don't know how to advocate, you won't realize that your experience in your pregnancy deserves and is required more attention than it's being given. And it's important because your outcome, how you go from pregnancy to a mother, is very important on how you speak up for yourself during your pregnancy, during your doctor's visits, during your lactation. If you have a lactation consultant or birthing classes, these are very important and very necessary, and especially even knowing where you're birthing. A lot of people just, I birthed at this hospital, but you really don't understand what the hospital can do for you and what the hospital might cause a harm for you. So knowing some of the rates, like how much C-sections are happening in this hospital, and what if I want to have a natural birth? What are some of the alternatives that you provide? How many mortalities have happened in your organization?
Ooh, that's deep.
Those are deep, and those are real questions. But that's, I mean, you have to be able to say, I really want to speak up for myself, so I have a really good outcome.
I like that. I like that. And I'll share my story maybe towards the end as well. So can we give examples? Because people are watching like, oh, I don't know. I don't want to bother the doctor. Like, what are common questions that women who are pregnant, planning to get pregnant, should ask their physicians or their clinicians or whoever is giving, plan? Like, what are questions to ask? Because that's important.
It's very important. And I think even before we get to your doctor's office, some questions and research that you need to do is really understanding where you're giving birth. I know we're having this live. We are here in the state of Texas, but every state have different laws. And I think it's really good to know what your state laws are when it comes to conception. Because I think we automatically go into, oh, what if this is a successful pregnancy? What if all this happens? What if it's not? And what if there are situations where you need to be able to advocate for yourself? Do you know what your state laws are regarding that, regarding conception? And then once you kind of make that decision, I always tell all of my clients, always have a contingency plan. Everyone plans for a wonderful birth, and that's what I pray for each of my clients. But I also ask them to have a contingency plan if things don't go as it should. And that's a conversation you should really have with your doctor on that first meeting. Like, hey, I'm so happy we got to meet. I'm glad they're going to get this pregnancy, but what are some of what's plan B if things don't go the way that we expected?
Understood.
Contingency plans are huge. Another question is always finding out, tell me more about you and the type of deliveries that you have done. And what are some complicated deliveries that you have gone through? And what are some that actually have been really smooth? And how have patients been able to have that rapport with you?
Okay.
And I always tell people to really understand how you feel in that setting, like how you're treated at the front desk, how you're treated by staff. All of that matters when you're about to come and see your physician. Ask your physician, how are there options of birthing? Like if I want to birth in the water, if I want to have a water birth, or if I want to have a natural birth, does the hospital that you work with, am I able to have those type of births there? If something was to happen again, like a pandemic, what's the policies around that? Will I be able to have my birth team? Will I be able to have my doula with me, my husband with me, my family member? And I think I see a lot of people run into this, and it's always towards the end where people are like, oh, I want a video and capture my experience. baby, you got to ask, because not everybody's going to allow you to bring
Mhm.
in visuals and things like that. So I always ask to go in with those type of questions, and really kind of gauge that relationship, especially if most doctor appointments aren't as lengthy. So always have your questions ready, have them written down
Yes.
and ready.
Yes. I tell people always have your questions in front of you, have pictures of your medications that you're taking. One of the things I see, because I used to do deliveries as well, is, do you want to be delivered by the same doctor? Is that something that's going to happen? Because sometimes you see the OB-GYN
Exactly.
consistently, but whoever is going to deliver you may be a different doctor. So sometimes they'll have you rotate with all the doctors. Are you okay with that? Do you prefer a male provider versus a female provider for the delivery? Those are all questions. VBAC, a vaginal birth after a C-section.
Mm-hmm.
Had people, who would see doctors who are comfortable with encouraging that. But you've got to ask those questions and know what you want and present it. If
Mm-hmm.
you're not a good fit to the doctor, at least you know and you can find somewhere else. All right. But it's not at the time of
Absolutely.
delivery, then you're like, oh, who are you? Oh,
Exactly.
no, I don't want you. No, I'm like, well, this is who I am, I am he. And so those questions are very, very important beforehand. Um, how do you suggest someone pick a provider? So yes, you get to ask the questions, but are there any online tools? Because you can't go through, like, by the time you go through 10 different doctors because you want to find a good fit, the baby is due. So do you have
Yeah.
any pointers for those who are watching? Like, how do you pick a good doctor? How do you pick, like, just by online research first before you actually meet the doctor? What are things to look out for?
Surprisingly, I think and I like to praise social media in its good ways. There are a lot of groups within your neighborhood or your environment that you can join, like in like moms group or this and like that groups, or local neighborhood groups. And in a lot of those groups, I see a lot of women being able to give their honest feedback. And sometimes that's hard to get when you're searching online at hospitals or you're calling your insurance and seeing what doctor is under
Insurance.
under my insurance plan. How do I know if they're good? I know for me, it's something about hearing from your community and hearing from the experiences of other women. Now, sometimes it can be overwhelming. So people are like, I had this horrible, I don't need your story. I just need to know if this doctor is really good. But I always have women like, first find out what has been a good provider in your local community that you've actually heard from. Another platform that a lot of people tend to use that I actually love to use as well, that kind of gives you a snapshot review. You can quickly see if you can book ZocDoc. Those are
Okay.
like quick resources that people can use. And then if you have a hospital that you've heard really good experiences from, it's really easy to see what doctors are working at those hospitals, what practices actually are signed on with those hospitals, and seeing, hey, let me read more about their feedback. Let me hear about how their reviews have been. I'm really big on, again, community, always hearing from
Mm.
people, the birthing world. If you know a doula, if you know a midwife, they're also going to be able to refer a really good provider if you decide to have a hospital birth or an out of hospital birth. So those are my big three areas, because a lot, like you said, online can get overwhelming, especially when sometimes you can't really get the clarity of who this provider is through reviews. Hearing
Mm.
from people who've actually had those
Mm.
experiences with them really helps.
I forgot to even mention, it's so funny, one of the guests that's watching, uh, breastfeeding. Like, you want to breastfeed, have the baby on your chest when you deliver, as long as the baby is doing fine. That's an option. You want to try to breastfeed first before they shove buttermilk in the baby's mouth. Like, yeah, like
Absolutely.
those things. All right. So how can women clearly communicate? Like, how do you empower women to communicate their concerns and preferences to their healthcare provider? So this is great that we're saying you could ask for this and ask for that, but they go in, they see the doctor, it's like, okay, we're going to do this. Da, 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 da. Like, how we talked about having your questions, but any other pointers so that they can kind of drive the visit too?
Yes. I think in the beginning of the visit, I think also setting the tone of how you would want the visit to go. So I know sometimes you come in, the doctor's like, okay, we're going to do this and this. And then you kind of get overwhelmed by, wow, the doctor's fast and I didn't really get to answer my questions. So I always say in the beginning of the introduction, when the doctor's introducing themselves and you're introducing yourselves as well, I think clarifying, like, I really look forward to engaging in our conversation today. And I really have some questions aside, like you're showing that I have questions already aside. So I'm hoping after this that we have some time to review those questions. So I'm always about, you gotta be the driver of the appointment at times, because doctors can't be like that. But if you let them know, hey, I'm here, I'm ready, and I've actually came ready, prepared for questions. So please, let's make sure that we have time at the end of my examination or anything to make sure that I can answer these questions. I think that's very important. And I always say, come with your questions ready, because when you get there, you get forget.
And Toby, it's also so important. Tell the MA, the medical assistant or the nurse before, tell them. You can even give a copy of the questions or type it down. It helps the doctor prepare ahead of you. So it's not like a shocker. So they know also. And as a physician, I'm saying this. I actually like when people come with questions. It tells me, oh, you're engaged in your healthcare. You come, you mean business. It makes it easier actually to help you because I can hit your pain points quicker. All right, good. Any other
or
tips?
even uploading them on portals, like
portals, yes,
upload that on the portal, so the doctor has done their homework before and know, okay, these are I saw your questions, let's go ahead and hit these questions that you wanted to ask, and still leave room for any clarification or follow-up questions.
I like it. Now my next question is, I've had women, and patients, but we're talking about women here, women and men, who say they felt dismissed. Like, I'll send a patient to go see a specialist and they'll come back and ask me what the specialist said. I'm like, you're the one who saw the. So they felt dismissed or unheard during their medical visits. Any advice for such people?
Yes. One of my biggest advice is, sometimes I know the quick reaction is just to like, oh, I felt dismissed, I'm going to find a different doctor. Where it could be, maybe the question wasn't fully clarified, maybe there was just some miscommunication, and really being able to step back and say, okay, after this appointment, I felt dismissed, I didn't feel heard. Communicate with your provider. Give that provider the chance to even clarify and be like, oh my gosh, I am so sorry. Because at the end of the day, we are human, right? And providers are definitely wanting to do their best to make sure that you have the care that you get. That is the belief that I like to walk away with. But I always say, have that conversation again, whether sometimes maybe face-to-face is a lot. So why not just send them a portal message? Hey, at this visit, I felt dismissed. I didn't feel heard. These were some questions that I still had that I didn't feel that was clarified. How can I ensure that these can be clarified and we can really have a thorough conversation where I leave with a good understanding? I always say, try to close that loop before you just, you know what, this doctor ain't trying to hear me. It could be many things. Again, sometimes the doctor that you're seeing probably just left a very critical birth and they're trying to check back in, and so a lot of things could be happening. But I think the human nature is always try to clarify that. And if you have like a nurse advocate like me, so I actually do come to some of my clients' appointments, or I actually do a follow-up with my clients after they go on their appointment. Hey, how was the conversation? Did you feel like there's any clarification you needed? And in those conversations, if I'm hearing that, well, the doctor, I was like, okay, well, let's go ahead and write those questions back in the portal. Let's go ahead and try to clarify some of the areas that you didn't really feel heard. I was trying to navigate that way. And if it seems to be a repetitive behavior, that's when, and repetitive is really after that trial of clarification. After that, I'm like, okay, well, we need to find your provider that's actually going to hear you and listen to you the way that you should be heard.
I like that. I'll share my story real quickly. I remember when I was having my second, it was the same hospital I used to deliver, but I was married, so my name had changed. So they didn't recognize me. Usually when you're pregnant, you look different a little bit. So I gone in, seen, and I had a cut, and I'd asked for pain medicine. They want to give me narcotics, and I said no, I didn't want. I wanted ibuprofen, but what was on formulary was actually naproxen. So they just need to give me something different. So I was in pain. Then I had to ask for food. I was hungry. I was like, when do I eat? They're like, oh, okay. And my husband was like, tell them who you are. I'm like, no, I want to see how my patients are treated. So I had to beg for food. I had asked for pain medicine. And on the way out, the lady was so rude. Like, she was like, I was bumping. I was in pain that I was so upset. And I turned around. I told her who I was. Oh, she turned red. She was really upset and embarrassed. because I really wanted to play out like, because you hear stories and you want to, for those of you who are watching, the data is real and
Mm-hmm.
it's scary, but we're not gonna roll down and die and play dead.
Mm-hmm.
We're gonna have to learn how to speak up and advocate. I teach patients how to ask for what you need and communicate your concerns because they are valid,
Absolutely.
right? And so this is me as a physician having to, then I just played it out like, okay, let's see. And then at the end I was like, I'm a physician here. And she was shocked. She was like, well, I say, so this is how you treat my patients, I will not be sending them here. So what we're doing is very important. And that segues to my question, a supportive birth team. How do partners and doulas or maternity nurses and what you do, how can that help amplify a woman's voice?
In many ways, honestly, because I think too, there's also this disconnect in healthcare, right? Most patients, most clients, or I call my patients clients, when they go into a hospital setting, they're trusting the system, they're trusting the experts, they're trusting those with the skilled ability to care for them. So a lot of times they refrain from wanting to ask questions or state something because they're not sure if they're actually correct or not, right? Or
Mm,
they're not sure, they don't want to step on any toes. And a lot of times having a birth team not only helps the advocacy part of making the client or the patient feel like they can voice their concerns, it also helps validate the patient. Like what you are saying is valid, but it's valid. You are being heard. Let's give you some more knowledge and insight. For me, I don't come in there and give my clients an answer. I actually give them knowledge so they can make the best decision for them.
makes sense.
So when you have a birth team, you're also getting the knowledge from the healthcare aspect. When you have a doula, when you have a labor and delivery nurse advocate, right? When you have someone who is giving you that knowledge so you can make an informed decision. When you make that informed decision, you are advocating for yourself. So it's very important, I think, more than anything, is to ensure that you have a birth team to make sure that you are prepared, not just for labor, throughout your pregnancy and postpartum. I think we just think that doula or a nurse advocate is, or a labor and delivery nurse advocate is only for when I'm about to deliver. No,
Deliver.
the advocacy is all through your pregnancy. I have had experiences, and I've also heard of other experiences where like providers are dismissive of a pain that you're having. Like, oh, that's just a part of pregnancy. Well, no, like something else is going on. Like, and if this is like, if I'm having some pelvic issues, can I not be referred to a pelvic floor therapist? Is there other alternatives out there so I don't have to continue my pregnancy in this horrible pain? I think that's why it's very important to have a well-rounded birth team before you just go straight into hospital or have a home birth.
I love it. I love it. Now, can you share with us success stories? So you've worked with people. Can you give feedback on their experiences and just to encourage our viewers on why this topic is very important, having an advocacy team for you, having a supportive birth team. Um, share some of your success stories based on what you do.
I would say what I love about what I do, the final feedback is like, wow, I had this beautiful experience. They get to look back and think of it as a beautiful experience and not necessarily something happening to them and they survived it. And I think one of the beautiful stories that sticks with me is I had a birthing client who birthed last year. And the work that I get to do is so intentional. It's not only about educating and showing up, but it's truly about creating an environment where it's a sacred space, where your environment is filled with love, it's filled with intentionality, so you can be in that aura before giving birth. And I know that this client, she was actually a high risk client. And I have a lot of high risk clients that reach out to me and still like, oh, I'm high risk, but can I still have this wonderful birth? And yes, you can, with the support of your providers and everything. So this particular client, I remember going with her to each of her appointments because she had high blood pressure. So that was a big deal for her, and being able to like, how can I continue this baby and not have to labor early? And I remember just going to all of her appointments, holding her hand, making sure that she clearly understands what the doctor is communicating and everything. And she was able to carry her child almost all the way to term. which was amazing because there was a point where she actually was in the hospital due to high blood pressure, and they were thinking about inducing her at 34 weeks. And when I saw the fight of a mother come out of her, she was like, no, I'm going to do it. I'm going to do my best. She was able to be discharged home and have her baby towards the ending of her pregnancy. And it was beautiful. And what I loved about it is got to curate that experience for her because she lost her mother at a young age, but I got to curate words of affirmations and beautiful scriptures, and have pictures of her mom in that birthing room. So she feels that there's a village here supporting her. And she felt that all through her pregnancy.
I saw the one where you had like different, you had the pictures on the wall. Absolutely. And you're standing there and you're support. And I'm like, what?
Because mothers deserve to be cherished. That's the
yes.
You don't just
oh my gosh
experience.
Oh my gosh, I love what you do. And we're about to wrap up, but I'm curious, Ajoke, where did that name come from?
Interesting question. So funny story. I actually wanted to actually had a different name in mind for it. And it's actually the name of one of my nieces that lives in Canada. But when I was looking for a name that literally embodied what I was trying to create, the holistic version of being able to have that continuation of care, supporting a mother where she has miscarriage, whether it's IVF, whether it's pregnancy, whether it's postpartum. I thought of a name that just embodies what it is to see a village of women in Nigeria caring for a woman, and pampering her and cherishing her. And Ajoke just stood out to me. Like, that name means someone to be cherished by all. And when I put all of the resources together for you, whether it's your birthing team, whether it's concierge service, whether it's supporting you during labor, all of those things come together to show that you are cherished and you're not going to walk this journey alone.
I love it, Ajoke. And literally that means Ajoke. We all care. We all cared and catered for. Wow. Powerful, girl. That's tough. Beautiful, beautiful. All right. So where can people find you? They're like, I like this. I like this lady.
Absolutely.
I need a team. Where can people find you?
So I make it simple and short. Ajoke Nursing Concierge.
That is not short. The woman. That's
the name. Ajoke Nursing Concierge. The name embodies everything. So going to the website, if you're looking for us on Instagram or Facebook, it is Ajoke Nursing Concierge. We're also on TikTok. It's ajoke.nursing.concierge. So anywhere you see that name, that's where you'll find me. And if you're wondering where you can find me, my name is Tobi Tajomavwo. There's only 3 of us in the United States of America. So if you research me, you will find me.
Oh, you're funny. That's a good one. Wow, this was so good. This was rich. We're going to do this again probably in about 6 months. I think actually we should do this at least yearly. We can do another one maybe later this year, but this is very, very powerful. Please, for those who are watching, send it to your friends who are planning to get pregnant, who are currently pregnant. Let's empower women to speak up for themselves, to advocate for themselves throughout their pregnancy and beyond.
And beyond.
Lives matter. Lives are at stake based on this. So this is powerful. Oh, and thank you, Charlotte, for watching. She said thanks for all you do.
Thank you.
So thanks. Keep up the good work. This is a ministry for you, woman. So receive grace. Receive grace. This is powerful. Thank you all for watching. I appreciate you. Appreciate the hearts, the likes. Cora, thank you so much for watching this. Please share, comment, and also give feedback on what struck you the most. Like what resonated with you the most, and what are things you're going to start to do based on this for yourself. Absolutely. As a woman who's empowered to advocate for herself. Okay. I'm so excited. Like, we're changing lives here. We're changing lives here.
Thank you.
So this is good. This is good. As always, I'm Dr. Olabintan. If you or someone you know is looking for an awesome, a thorough, and compassionate family physician who will have conversations like this, even on a Tuesday evening.
Hello.
I'm she. End of story. Thank you so much. Tobi, hang around. I want to talk to you after. This was good. I want to appreciate you. So thank you all for watching. I appreciate you. Remember, sharing is caring. Make sure you share with a friend or two.